Hello and welcome back to my YouTube channel. In today's video, I will be talking about pneumonia. So, I will be covering the definition, classification, pathophysiology, and management of pneumonia in this video. Let's get started. So, what is pneumonia? Pneumonia is the inflammation of the lung parenchyma caused by infectious agents like bacterial, viral, and fungal agents. It is a significant cause of morbidity and mortality worldwide. Talking about classification of pneumonia. By origin, pneumonia is classified as community acquired pneumonia, hospital acquired pneumonia, and ventilator associated pneumonia. By organism, it can be typical or atypical. Like typical is caused by Streptococcus pneumoniae, and atypical could be caused by Mycoplasma, Chlamydia, and Legionella. By clinical setting, it could be a aspiration pneumonia or immunocompromised host pneumonia. Commonly implicated etiological agents are Streptococcus pneumoniae, Haemophilus influenzae, viral agents like influenza virus, RSV, SARS-CoV-2 virus, fungal like Pneumocystis jirovecii in HIV patients, and others are Mycoplasma and Chlamydia. Pathogenesis of pneumonia. Well, when there is entry of pathogen via inhalation or aspiration, there is alveolar macrophage activation after neutrophilic exudation and septal congestion, leading to an inflammatory response and causing consolidation of the alveoli later. I will be explaining it in detail in further slides. When large portion of lobe of lung is involved or the complete lobe is involved, then it is known as lobar pneumonia. When there is patchy consolidation along bronchioles, then it is known as bronchopneumonia. There are four stages of lobar pneumonia: congestion, red hepatization, gray hepatization, and resolution. I'll be showing you these stages in further slides. And in bronchopneumonia, there will be patchy consolidation around bronchioles. Histologically, you can see congested septal capillaries, neutrophilic infiltration, alveolar exudation, which is a part of red hepatization and congestion, and then later gray hepatization when there is transformation of exudate into fibrous masses surrounded by macrophages and fibroblasts. So, as I have told you, stages of pneumonia are four. Stage 1 is congestion, stage 2 is red hepatization, stage 3 is gray hepatization, and stage 4 is resolution. This micrograph shows septal congestion and neutrophilic exudation. You can note the congested septa and the neutrophils within the alveoli. In this micrograph, you can appreciate fibrin deposition in the alveoli. Talking about the clinical features or in pneumonia, well, the patient could present with high fever, chills, pleuritic chest pain, productive cough, dyspnea, tachypnea, hypoxia, and on auscultations, rales are audible. Main investigations are chest X-ray, which show consolidation and infiltrates. Complete blood count shows leukocytosis. Sputum culture and sensitivity and blood culture should be performed, and CRP and procalcitonin should also be done. Management is done by antibiotics based on the etiology. For example, amoxicillin is given for streptococci pneumoniae. Supportive care in form of oxygen therapy, fluids, and antipyretics can be given. And hospitalization criteria is depending on the SCRB 65 score. The complications of pneumonia could be pleural effusion, lung abscess, sepsis, and acute respiratory distress syndrome. For prevention, vaccination against pneumococcal and influenza virus should be done. Hand hygiene and smoking cessation are other preventive modes. So, to summarize, pneumonia is a treatable but potentially serious infection. Early diagnosis and appropriate therapy is essential, and vaccination plays a key role in prevention. Hope you will find this video useful. If you're liking my videos, don't forget to subscribe my channel. Thank you and bye for now.